Good evening. If you are just joining us, you are watching Silent Waves emergency coverage. I am Alex Mercer. What we are about to walk you through is not a drill, not a simulation, and not something any of us in this studio prepared for when we came to work this evening. We are approximately 45 minutes into what health officials are now calling a, quote, unprecedented viral emergence event. And the information is changing so rapidly that our editorial team has made the decision to go wall to wall until further notice. We are asking our broadcast partners across the globe to carry this feed without interruption. My co-anchor, Sierra Lane, is with me, and together we will be your guides through what may be the most consequential 24 hours in modern history. Here is what we know right now. A previously unidentified respiratory pathogen, temporarily designated NX9, has been simultaneously reported in at least 11 major cities across 4 continents. The first confirmed clusters appeared within a 6-hour window, which virologists reached by phone have already described as extraordinarily alarming. The cities confirmed at this hour are Tokyo, Jakarta, Lagos, Sao Paulo, Mumbai, Cairo, London, Chicago, Sydney, Nairobi, and Madrid. We want to be precise. We are not talking about suspected cases or unverified social media reports. We are talking about confirmed laboratory positives from health ministries that have already been cross-referenced with the World Health Coalition's Emergency Tracking Division. The transmission rate, as best as epidemiologists can calculate at this early stage, appears to be substantially higher than any virus in recorded history. We will keep you updated with every new piece of verified data as it comes in.
And Alex, I want to take a moment before we go any further into the numbers, because I think it is important for everyone watching right now to understand what this feels like for the people on the ground in those cities. We have been receiving messages since this broadcast began, flooding into our emergency viewer line, and I want to read one right now from a woman who identifies herself only as Priya, writing from Mumbai. She says, and I quote, "I was at the market when my neighbor collapsed. By the time the ambulance came, 3 more people were on the ground. The medics looked frightened. That scared me more than anything else." That is the reality in Mumbai tonight, a medic's fear. Because when the people trained to remain calm begin to show fear, something in the human gut recognizes that the world has shifted. We are receiving similar messages from Jakarta, where a viewer named Daro writes that his entire apartment building has been told to shelter in place by loudspeaker announcement from the street below. He says he can hear sirens constantly. He says he has not heard silence in over an hour. We are going to keep reading your messages throughout this broadcast because we believe your voices matter as much as any government statement tonight.
Exactly right, Sierra. And let me add some structural context to those personal accounts. At this hour, we are 1 hour and 12 minutes into confirmed global reporting. The World Health Coalition convened an emergency session 22 minutes ago. Their preliminary advisory, transmitted to member nations at approximately the same time we came on air, characterizes NX9 as airborne, with what they are calling a high-efficiency aerosol transmission profile. What that means in practical terms is that this virus does not require close contact in the conventional sense. It appears capable of remaining viable in open air for a duration that their scientists have not yet precisely measured. But initial field data suggests it may be significantly longer than influenza or earlier known coronaviruses. The incubation window appears to be between 2 and 6 hours, based on the timeline reconstruction that epidemiologists in Tokyo and London have independently produced. That is an extremely short incubation period. It means someone infected at noon could be symptomatic and infectious by mid-afternoon. Now, the symptom profile. Initial presentation includes severe headache, sudden fever spike above 40 degrees Celsius, and what clinicians are describing as rapid pulmonary inflammation. Essentially, the lungs begin reacting with unusual speed and severity. We do not yet have mortality statistics. What we do have is a hospitalization rate that health ministers in 3 countries have already described as, quote, immediately overwhelming.
We now have an official statement from the Director General of the World Health Coalition, and I want to read it in full because every word of it matters. The statement reads, "The World Health Coalition is tracking a global emergence event of serious concern. Member nations are advised to immediately activate emergency health protocols, suspend non-essential public gatherings, and begin preparation of overflow medical capacity. We are working around the clock to characterize this pathogen and will provide updated guidance every 2 hours. We ask all citizens worldwide to remain calm, follow the instructions of their local health authorities, and avoid unnecessary travel." That is the full statement. What I notice, and I think our viewers will notice, is the phrase serious concern. In coalition language, that phrase sits one level below global emergency. We may be watching that language change in real time before this night is over. What I also notice is what the statement does not say. It does not say we have it under control. It does not say the situation is contained. 14 years of covering these institutions has taught me that silence around containment is its own message. We are not contained. We are watching this unfold in real time, and the men and women in that coalition chamber are doing so alongside us.
We are now receiving updated numbers from our correspondents in the field. I want to be transparent about the sourcing on these figures. They are coming from hospital spokespeople, municipal health departments, and in some cases from on-the-ground journalists who are physically present at medical facilities. These are not yet official government releases, but they are credible, multi-sourced, and consistent enough that we feel confident reporting them. In Tokyo, Keio University Hospital is reporting 412 emergency admissions in the last 90 minutes. Tokyo Metropolitan Hospital has confirmed 3 deaths, the first confirmed fatalities in this event. In Lagos, the National Hospital Abuja is reporting surge capacity has already been reached. Staff have reportedly begun setting up triage stations in the hospital car park. In Sao Paulo, the Albert Einstein Hospital has issued a public statement asking anyone with mild symptoms to please not come to the emergency room. In London, NHS England has activated what it calls its black level response, their highest emergency threshold. Hospitals across Greater London have begun canceling elective procedures and recalling off-duty staff. The picture that emerges from all of these data points is one of a health system that, across multiple continents simultaneously, is beginning to bend under a weight it was not designed to carry.
We are 2 hours and 40 minutes in now, and I want to talk about something that often gets overlooked in moments like this, which is what is happening to families. Not patients, families. Because for every person who collapsed in that Mumbai market that Priya described, there are parents, children, siblings who are now somewhere between terrified and desperate. We have a message from a man named Owen writing from Chicago's North Side. He says, "My wife works at Rush Medical Center. She called me an hour ago and said she could not talk, she was too busy, and that she loved me. She has never done that before in 12 years of marriage." I want to sit with that for a moment. A phone call that felt like a goodbye from a woman who chose medicine as her life's work, in the middle of something she has trained for but perhaps never truly imagined. Owen, we hear you. And we suspect there are thousands of people right now making those same calls, sending those same texts, choosing the same careful words that mean more than they are allowed to say. This broadcast is for them too.
We are getting new geographic data in now. The confirmed affected cities list has expanded. We can now add Seoul, Karachi, Buenos Aires, Toronto, Johannesburg, Istanbul, Bangkok, and Casablanca to the confirmed cluster list. That brings the total to 19 cities across 6 continents. No confirmed reports yet from Antarctica's research stations, and the few island nations with limited international air traffic remain unconfirmed. But I want to pause on something statistical that is genuinely extraordinary. Public health models for pandemic spread typically show a disease moving outward from a single origin point over days or weeks, with early clusters appearing in areas connected by travel corridors to that origin. What we are seeing tonight does not fit that model. 19 cities, 6 continents, a 6-hour simultaneous window. That does not behave like organic viral spread. Our public health analyst, reviewing the data remotely, has noted that the pattern is, quote, consistent with near simultaneous environmental exposure across multiple locations. But she is careful to say that no origin theory has been confirmed. What is confirmed is the effect. This virus is everywhere. It arrived nearly at once, and it is now spreading person to person at a rate that every early model suggests is catastrophic.
We have just received a viewer message that I need to read immediately. It comes from a nurse named Camille, writing from Lyon, France, a city not yet on our confirmed list. She writes, "We are seeing it here too. My ward has 17 patients presenting identically. I am not supposed to say anything yet, but people need to know. Camille, we hear you, and we are grateful for your courage. That single message, if accurate, tells us that the confirmed list of 19 cities is already outdated. It tells us that health workers on the ground are seeing things before official channels can process and report them. And it tells us something about the courage of the people on the front line of this. People who are exhausted, perhaps frightened, perhaps already exposed, and who still find it in themselves to reach out through whatever means available to make sure the rest of the world is informed. Lyon, France. We are adding that to our unofficial tracking list, and we are working to independently verify."
It is now approximately 3 hours and 20 minutes since the first confirmed reports crossed official channels. The situation regarding air travel is developing rapidly. The Federal Aviation Administration in the United States has implemented what it calls an emergency airspace advisory. Not a full shutdown, but a directive for all domestic commercial carriers to voluntarily hold departures pending a safety review. 3 major American carriers have already complied voluntarily. Chicago O'Hare International has suspended all international arrivals. London Heathrow has done the same. Tokyo's Narita Airport has been placed under full government quarantine order. Nothing in, nothing out. The cascading effect on air freight is going to be significant and is going to affect supply chains we don't immediately think of. Pharmaceutical shipments, medical equipment, blood products, food. The moment airports begin closing, the global circulatory system of modern commerce begins to clog. We are also getting reports from Jakarta that the port, one of the busiest maritime ports in Southeast Asia, has halted all vessel operations. Port workers have been sent home. 42 container ships are at anchor in the harbor. Their cargo, including refrigerated goods and medical supplies bound for 17 countries, is sitting still.
I want to tell you about what is happening on the streets of Cairo right now, because we have been in contact with a local journalist there named Farouk, who has been sending us updates by text message. Farouk says that the Egyptian government announced a curfew 40 minutes ago, a complete dusk to dawn restriction on movement nationwide. And he says the response was immediate panic. People flooded grocery stores. Pharmacies were overwhelmed in minutes. He says he watched a man weep openly outside a pharmacy that had closed its shutters. Not because he was sick, because he was afraid. He had not eaten yet, and his children were home, and he did not know what came next. I think that image, a man weeping outside a closed pharmacy in Cairo because the future had become suddenly terrifyingly unclear, I think that image captures something essential about what a crisis like this does to the human spirit before it does anything to the human body. The fear is the first infection. It spreads before the virus does, and it causes its own kind of damage. Hoarding, panic buying, crowds that ironically create the very exposure they are trying to avoid.
Confirmed fatality update at the 4-hour mark. The World Health Coalition has now released its first official casualty report. Globally confirmed deaths, 341. Confirmed hospitalizations, 72,418. Those numbers will be out of date before I finish this sentence. The mortality profile from clinical data gathered so far indicates that NX9 is most severe in adults between the ages of 20 and 50, which is unusual. Most respiratory pathogens are most dangerous to the very young and the very old. This one appears to strike hardest at people in what we would normally consider the prime of life, which has significant implications not only for families, but for workforces, emergency services, and military readiness. The symptom progression being documented by hospitals in Tokyo, which has the most organized data at this point, goes as follows. Onset of fever and headache, followed within 2 to 4 hours by respiratory distress, followed in severe cases by what clinicians are calling cytokine cascade, essentially the immune system overreacting and attacking the lungs themselves. Treatment options are being explored urgently. There is no known antiviral with proven efficacy against NX9 at this hour. Hospitals are managing symptoms, supporting breathing, and praying for time.
We are getting word that schools across South Korea, India, and the Philippines have issued mass closure announcements effective immediately. Not tomorrow, tonight. Parents are being contacted now to collect their children from after-school programs and evening activities. And I want to think about what that means in practice. The logistical reality of suddenly needing every child home, every parent scrambling, every after-school bus route canceled, in the middle of a global emergency where the streets themselves are becoming frightening places. We have a message from a teacher in Seoul named Ji-won. She writes, "I have 31 children in my classroom. I have been told to keep them here until their parents arrive. I have been here 3 hours. 17 children are still waiting. I am singing songs to keep them calm. I will stay as long as I need to." Ji-won, there are not words adequate to what you are doing right now. You are the definition of what it means to be a professional, a caregiver, a human being in a moment of crisis. We hope you know that.
5 hours in. I want to update the infrastructure picture because it is deteriorating faster than models suggested. Power grid operators in northern India have reported a surge-related failure in 2 distribution substations serving parts of New Delhi. The failure is attributed to simultaneous demand spikes from hospitals switching to full emergency power protocols across the city. Parts of New Delhi are currently experiencing rolling blackouts. In Sao Paulo, the water utility has issued a precautionary advisory asking residents to fill available containers as maintenance staff numbers have been reduced due to illness and non-reporting. In Chicago, the interstate highway system is experiencing what transportation officials are calling unprecedented non-emergency gridlock as residents attempt to leave the metro area. Interstate 90 westbound is at a complete standstill from the city center to the suburbs. Emergency vehicle response times in Chicago have reportedly tripled as a result. We are also hearing from the Lagos State Emergency Management Agency that communications infrastructure in parts of the city is degrading. Cell towers are overwhelmed with call volume, and some neighborhoods are experiencing dropped signal. This is critical. When communications fail in a crisis, information vacuums fill with rumor, and rumor accelerates the panic that drives the dangerous behaviors we described earlier.
We have just received a statement from the president of the fictional nation of Valdria, a major regional power in our reporting area, and I want to read it because it represents the first head of state address we have received. The statement reads, "To the people of Valdria and to our friends around the world, tonight we face a challenge unlike any in our history. Our government is activating all emergency health reserves, nationalizing hospital capacity, and deploying the National Defense Health Corps to assist civilian medical infrastructure. We ask for calm. We ask for solidarity. We ask that every citizen see in their neighbor not a threat, but a fellow human being who is frightened and needs their strength. Those words, not a threat, but a fellow human being. I find myself moved by that, because in every crisis we have covered on this network, one of the first things to fray is community. Trust breaks down. People begin to see strangers as vectors, and the moment a political leader names that impulse explicitly and asks people to resist it, that is a meaningful thing. Whether the policy follows the rhetoric, we will watch. But the words tonight from Valdria were right.
We are 6 hours in. I want to take a comprehensive look at where we stand globally. Confirmed affected cities, 37, across every inhabited continent. Confirmed deaths, 2,114. That number has increased sixfold in 2 hours. Confirmed hospitalizations, 341,000. The growth curve is not flattening. Every epidemiological model we have access to tonight is projecting continued exponential rise. The World Health Coalition has now formally elevated its alert status to global emergency, the highest designation in its charter. This triggers automatic protocols, including the international pooling of pharmaceutical stockpiles, authorization for emergency experimental treatment protocols, and the convening of a global command authority with representatives from every member nation. Military assets in 14 countries have been put on standby to support civilian logistics and enforce quarantine orders where necessary. The United States has activated FEMA's National Response Framework at its highest tier. The European Union has convened an emergency session of its Health Security Committee. China's National Health Commission has placed all provincial health authorities on wartime footing. Their word, wartime. We are 6 hours into this. The world has not been in a state like this within living memory.
I need to share something personal with our viewers, and I hope you will forgive me the moment. About 20 minutes ago, I received a text message from my sister who lives in Melbourne, Australia. She told me that her neighborhood has gone completely quiet, that people retreated indoors simultaneously as if someone gave a signal she didn't hear. She said she stood at her window and watched the street empty in the space of about 5 minutes. She said it was the most frightening thing she had ever seen, not because anything violent or dramatic happened, but because silence in a city means something is wrong. The absence of ordinary life is its own catastrophe. I told her I loved her. I told her to stay inside, to stay hydrated, to keep her phone charged. And then I came back on air because that is what she would want me to do. And because I think all of you out there, in your houses, your apartments, your hotel rooms, deserve to have someone sitting in front of a camera and telling you the truth without flinching. That is what we are here to do.
7 hours in. We have breaking infrastructure news. The Channel Tunnel linking England and France has been officially closed by joint order of the British and French governments. The closure is effective immediately and is described as indefinite. The Trans-Siberian Railway has suspended passenger operations across all Russian segments. South Africa has closed all land border crossings. Brazil has ordered a shutdown of all international ports of entry by executive decree. In the United States, President, we will not use names, as this is a fictional broadcast. The head of state has signed an executive order granting federal agencies emergency authority to commandeer private facilities, including hotels, convention centers, and sports stadiums for use as emergency medical sites. The first such commandeering has already taken place. Madison Square Garden in New York City is being converted into a field hospital as of this hour. Chicago's United Center is next on the list. We are also receiving reports that pharmaceutical companies in Germany, India, and the United States have been placed under government emergency authority, meaning their full production capacity is being redirected to antiviral research and production of supportive care medications. The global economy, in a very real and immediate sense, has shifted onto a wartime footing.
9 hours. We are 9 hours in. And I want to talk about courage because the dark deserves light. A firefighter in Mumbai named Raj organized his entire station, 14 people, into a volunteer medical transport unit. They converted their fire trucks to carry patients when ambulances ran out. 14 firefighters driving fire trucks through Mumbai's impossible traffic, carrying sick people to hospitals. Halfway through the city, Raj himself began showing symptoms. His crew says he refused to stop. He said, I will stop when everyone is delivered. He delivered everyone. Then he stopped. Raj is now in hospital himself, in the isolation ward at Leelavati Hospital. We do not know his condition. What we know is that he drove until he couldn't. That is courage in its most naked form. We are also hearing from Nairobi, where a network of community health workers, mostly women, mostly unpaid, working in the informal settlements that ring the city, have begun a door-to-door information campaign. With no government direction, no formal coordination, and limited supplies, they are going house to house, telling people what is known, what is not known, and how to care for the sick at home when hospitals are unreachable. Their names are not in any official report. They are the invisible infrastructure of human survival.
At the 10-hour mark, I need to give you a comprehensive mortality update, and I want to contextualize it carefully. Global confirmed deaths are now 12,890. This is not a final number. This is the number that has been officially logged. Field reports from multiple locations suggest actual deaths are significantly higher. Hospitals in some areas have lost the capacity to formally process deaths as they contend with the living. The city hardest hit at this moment appears to be Jakarta, Indonesia. The city of 11 million has reported 4,000 deaths in the last 3 hours. The governor of Jakarta has declared a, quote, citywide emergency beyond the capacity of normal governance, and has requested United Nations intervention. In response, the UN Secretary General, again, a fictional figure in our broadcast, has authorized the deployment of the UN Emergency Health Force, a rapid response body that, it must be said, has never before been deployed at the scale now being requested. They have assets in Singapore, Dubai, and Nairobi that are being mobilized as of this hour. We are also receiving reports of power grid failures in 3 additional countries. Greece, Pakistan, and Ecuador are all experiencing significant outages as their electrical infrastructure, under emergency hospital load and reduced maintenance staffing, begins to fail.
We want to read more of your messages. A viewer named Thomas, writing from rural Manitoba, Canada, says, "We are 6 hours from the nearest hospital. We have about 40 people here, including 12 elderly residents who cannot travel. I am a retired nurse. Tell me what to do. Thomas, we hear you." The advice from medical authorities at this hour for communities without immediate hospital access is isolate anyone with symptoms, maintain distance, ventilate enclosed spaces, prioritize hydration, and contact your regional emergency line. We know those lines are overloaded. We know the advice feels insufficient for what you are facing. But you are not alone, and what you are doing, being present, being a nurse again when your community needs one, is the right thing. We also have a message from a 12-year-old named Anya in Krakow, Poland, who writes, with remarkable composure, "My mom is sick. My dad is at the hospital with her. I am at home with my little brother. He is 7. I told him we are having a sleepover adventure. I made us both hot chocolate. I need you to tell me it will be okay. Anya, you are 12 years old and you are doing everything right. You are brave and you are kind, and the fact that you made your brother hot chocolate and called it an adventure, that is one of the most beautiful things we have heard tonight. It will be okay. We believe that. And we think you believe it too, or you wouldn't have reached out to us."
12 hours. We are at the halfway point. Here's the state of the world at midnight in this broadcast. Global deaths, 41,209. Confirmed hospitalizations, 1.7 million. Countries with confirmed cases, 112 out of 195 globally recognized nations. Countries with no confirmed cases, largely limited to island nations. Landlocked states with minimal external contact. And a small number of nations whose reporting infrastructure has itself collapsed, meaning we cannot confirm or deny. The category of collapse is itself important. We are receiving reports from 3 West African nations that their health reporting systems, the very infrastructure that would tell us what is happening, have gone silent. Not because nothing is happening, because the systems that would report it have broken down. We have also lost reliable contact with our correspondent in Karachi, Pakistan, where communications infrastructure appears to have failed citywide. The last message we received from her, approximately 90 minutes ago, described a hospital with no power, operating on backup generators, with patients in hallways and a courtyard. She said the staff were still working. Then the signal cut. We have not heard from her since.
There is something I need to say about fear right now, because I think we are at the hour in a crisis when fear risks becoming its own catastrophe. 14 hours ago, the world had what we thought of as normal problems. Supply chains, political disagreements, the ordinary friction of human civilization. Now we have this. And in cities across the world, we are seeing fear express itself in ways that are entirely understandable and entirely dangerous. There are reports of violence at food distribution points in Jakarta, reports of hospitals in Buenos Aires being mobbed by people who are not sick, but are terrified they will become sick, which has created congestion that is preventing ambulances from reaching the entrance. There are reports from Chicago of opportunistic looting in neighborhoods where police have been diverted to medical emergencies. Fear is not a character flaw. Fear is a human response to genuine danger. But fear unchecked, fear without information, fear in a vacuum. That becomes a second disaster running alongside the first. This is why we are on the air. This is why your voices matter. Every message of community solidarity, every act of quiet courage, every person who chooses to help rather than hoard, you are fighting the second disaster. And we need you to keep fighting it.
15 hours. Critical infrastructure update. We are now tracking power failures in 11 countries. The nations currently experiencing significant grid outages include Pakistan, Ecuador, Greece, Nigeria, Bangladesh, the Philippines, Ukraine, Peru, Venezuela, Senegal, and Zimbabwe. For some of these nations, Pakistan, Nigeria, Bangladesh, the power failures are compounding an already catastrophic medical situation. Hospitals on backup power have a finite window. When generators run out of fuel and supply lines have broken down, what happens inside those hospitals is something we can describe clinically. It is the cessation of life-sustaining equipment. But the human reality of it is something we do not have adequate language for. We are also now tracking a food supply crisis. The World Food Programme's Emergency Coordination Team has issued an alert that refrigerated food distribution networks across 47 countries are at risk of collapse within the next 48 to 72 hours if current transportation shutdowns continue. The practical meaning, food that was produced, that exists, that could feed people, may spoil before it reaches them. We are working to confirm reports from supply chain analysts who are telling us that certain nations, particularly island nations in the Pacific and Caribbean, have at most a 7-day food supply in country with no incoming shipments expected.
16 hours. I need to tell you about what is happening in the hospitals as best we can report it from the outside because it matters that the people inside those walls are seen. Nurses, doctors, respiratory therapists, orderlies, cleaners. Tens of thousands of health workers around the world who came to work today not knowing what they were walking into. We have a message from a physician in London who signs only as doctor at King's. She writes, "We have not stopped for 12 hours. I don't know who is infected among my own team. I don't know if I am. I don't know if my children are okay because I left before they woke up and I cannot reach my husband. I am writing this between patients. I am terrified. I am also doing my job. Please tell people what we are doing in here. Please make sure someone sees us. Doctor at King's, we see you. This broadcast sees you. The world sees you. You and your colleagues across every time zone tonight are doing the most demanding, the most important, and the most quietly heroic thing a human being can do. You are staying when everything in biology tells you to flee. Thank you. From all of us. From every patient and every family and every person who will live because of what you are choosing right now."
18 hours into our broadcast, I want to give an updated global picture with the most current confirmed figures available to us. Confirmed deaths, 214,731. The number has crossed 200,000. Let me repeat that so it has the weight it deserves. More than 200,000 people have died in 18 hours. Confirmed infections in official records, 11,400,000. Estimated actual infections based on growth modeling and hospitalization rates are between 80 and 120 million. The gap between confirmed and estimated reflects testing capacity, not the virus's reach. NX9 does not care whether it has been formally documented. It is moving through the world's population at a speed that no previous pathogen in the modern era has approached. The World Health Coalition has now formally used the phrase existential health event in an internal communication that has been leaked to our network. We are reporting it with that caveat. It is internal, it is leaked, but multiple sources have confirmed its authenticity. Existential health event. Those words mean what they say.
We are getting new information from South America. In Brazil, the governor of Rio de Janeiro has issued a statement saying that Maracana Stadium, one of the largest in the world, has been fully converted to emergency medical use and is already at capacity with 12,000 patients. 12,000 patients in a stadium. That is not a hospital. That is a field triage center at the scale of a city. Medical volunteers from across Brazil have reportedly traveled hundreds of miles to staff it, some arriving by motorcycle when roads became impassable. We also have extraordinary news from Paraguay, which shares a border with Brazil. The Paraguayan government has mobilized its entire military, not to protect borders, but to serve as a national health auxiliary force. Soldiers are doing everything from driving ambulances to cooking meals for hospital staff who cannot leave. Their general issued a statement that reads in part, "We train to defend our nation. Our nation is under attack. We are defending it." That is a commander who understands what the threat actually is tonight.
20 hours in. I want to talk about the research community because in the middle of everything we are describing, the deaths, the failures, the grief, there is a story of human scientific ingenuity running in parallel that deserves attention. Laboratories in 12 countries have been working without pause since the first confirmed cases. We have confirmed reports of 3 independent research teams, one at a university in Zurich, one at a government lab in Seoul, and one at a private institute in Bangalore, India, who have separately identified what they believe is a vulnerability in the NX9 protein structure that could be targeted by existing antiviral compounds. These are preliminary findings. They have not been peer-reviewed, and they have not been clinically tested. But the World Health Coalition's Emergency Scientific Committee has reviewed all 3 independently and has described them in a communication to member governments as, quote, promising enough to justify immediate accelerated clinical trials under emergency authorization. 3 teams, 12 hours of research, a potential target. It is too early for certainty, but it is not too early for measured hope.
We are at 21 hours. Let me read you something from a viewer named Marco, writing from a small town in the mountains of northern Italy. He says, we are 93 people in this village. No one has left. No one has come in. We have enough food. We have enough medicine for basic needs. We have 2 doctors who retired here. We have decided that we will take care of each other. I am writing this because I want someone to know that a small place can still choose to be decent. Marco, you have made my heart feel lighter. 93 people in a mountain village in northern Italy who have collectively decided to be decent. In the middle of all of this, it should not feel extraordinary, and yet it does. Because decency in a crisis of this magnitude is a radical act. It is the refusal to let fear dictate your values. It is the insistence that the person beside you is still a neighbor and not a threat. Marco's village does not have a name in our broadcast. It does not need one. It is every small community tonight that is choosing solidarity over fear. It is proof that the second disaster, the human one, does not have to win.
22 hours. Here is where we stand. Globally confirmed deaths have crossed 500,000. I am going to let that number exist in silence for a moment before I continue. 500,000 deaths in 22 hours. The affected city list is now effectively meaningless as a discrete category. What health authorities are now tracking is unaffected zones, which are narrowing rapidly. The nations of Iceland, New Zealand, Bhutan, and a handful of Pacific Island nations remain officially unaffected. New Zealand's government has sealed its borders completely and is enforcing a maritime exclusion zone around its coastline. The infrastructure picture. Global air travel is now at approximately 12% of normal capacity. Maritime shipping is at roughly 30%. Land transport in most urban zones is severely degraded by a combination of gridlock, road closures, fuel shortages, and emergency vehicle priority restrictions. 17 national power grids are now fully or partially offline. The global internet, while still functioning, is experiencing severe congestion in several major backbone arteries as traffic volumes hit historic highs, with the entire connected world simultaneously trying to communicate, access information, and coordinate.
23 hours. We are almost through the first day, and I want to hold that thought for a moment, almost through the first day, because there will be a second day, and a third. And what the people in those hospital corridors, in those village squares, in those converted stadiums, and in those mountain towns need to know, what the nurse in Seoul who is still singing to 17 children, and the firefighter in Mumbai who drove until he couldn't, and the 12-year-old in Krakow who made hot chocolate and called it an adventure, what all of them need to know is that the world they are fighting to save is still worth saving. I believe that. I believe it with everything in me. Because tonight, while the news has been devastating, I have also watched human beings reach across every boundary, language, geography, politics, fear, and extend a hand. I have watched a soldier decide his training was for this. I have watched a retired nurse become necessary again. I have watched communities decide, quietly and without fanfare, to take care of each other. That is not the end of the world. That is the world at its most human.
We are approaching 24 hours. Before we give you our final comprehensive briefing, I want to say this. What you are about to hear from Sierra and me in the next several minutes will include some of the gravest numbers we have reported tonight. The situation is not resolved, but it is not without hope. And the reason it is not without hope is complex and multiple. It includes the scientific findings from Zurich, Seoul, and Bangalore. It includes the unprecedented mobilization of governmental and non-governmental resources. And it includes something that no model predicted and no statistician quantified. The extraordinary, stubborn, an apparently limitless capacity of human beings to help each other when the alternative is unacceptable. Now, let me give you the 24-hour briefing.
At the 24-hour mark, this is the human reality. More than 800 million people are in some form of government-mandated lockdown or shelter-in-place order across 47 countries. Hospitals in 62 nations have reached or exceeded capacity. Emergency field hospitals, converted stadiums, schools, and community centers are housing an estimated 4 million patients worldwide. Millions of healthcare workers are on continuous emergency rotations, many having not slept in over a day. In some of the hardest hit cities, Jakarta, Lagos, Sao Paulo, informal community care networks have become the primary healthcare infrastructure for millions of people who cannot reach a hospital. Neighbors caring for neighbors. Elders being carried to ventilated rooms. Children being taught to measure fevers and provide fluids by WhatsApp voice note from overwhelmed nurses. Human civilization, stripped to its wire, is doing what it always has done, adapting, surviving, reaching for the person beside it in the dark.
Here is the complete 24-hour statistical picture. Total confirmed global deaths, 841,316. Total confirmed infections, 230 million. Estimated actual infections, between 1 and 2 billion. Total countries with confirmed cases, 173. Countries with no confirmed cases, 22, all either geographically isolated or having implemented total external closure within the first 3 hours. Infrastructure status. 31 national power grids remain partially or fully offline. Global air travel suspended by international agreement at the 18-hour mark. Maritime shipping reduced to emergency and humanitarian cargo only. Global internet functioning, but degraded. Financial markets in 17 countries suspended trading indefinitely. Supply chains for food, medicine, and fuel are under severe stress in every populated region. Military assets in 64 countries have been fully redirected to civilian emergency support functions. The World Health Coalition has issued wartime equivalent authority to its Emergency Scientific Committee to authorize and accelerate any treatment protocol showing promise.
And now the conclusion, because we promised you one. Because in a crisis of this magnitude, the people watching deserve to know what comes after the longest night. The world did not end. Let that be said plainly and without equivocation. The world did not end. What happened over the following weeks was agonizing, costly, and transformative. The 3 research teams' findings proved correct. An antiviral compound already in limited production for a different pathogen was found to reduce NX9 mortality by 67% when administered in the early symptomatic phase. Emergency global manufacturing, authorized under wartime protocols, brought it to scale within 11 days. 11 days is a long time when people are dying at the rate we described tonight. But 11 days is also an extraordinary scientific achievement, arguably the fastest medical countermeasure deployment in human history.
The final confirmed global death toll from the NX9 event stood at 4,200,000 over a 60-day period, the period from outbreak to effective suppression. In historical terms, that number exists alongside the worst epidemics in the modern era. It is not a small number. It is not a number that statistics can adequately mourn. Among the dead were health workers, community volunteers, elderly residents of care facilities, young adults who had every expectation of long lives, and in a pattern that haunted public health officials for years afterward, a disproportionate number of people in their 30s and 40s who left behind young families. The cities hardest hit, Jakarta, Lagos, Sao Paulo, Mumbai, lost between 1% and 3% of their populations. Their infrastructures were devastated, and required years of reconstruction. Jakarta's port did not return to full capacity for 14 months. Lagos rebuilt its communications infrastructure with international aid and in the process created what became one of the most resilient digital networks on the African continent. São Paulo's converted stadium hospitals became the model for a new permanent emergency medical infrastructure protocol adopted by 40 nations.
The world that emerged from the NX9 event was different. Not collapsed, not broken beyond repair, but changed in ways both visible and invisible. Governments that had gutted public health systems spent years rebuilding them, chastened by what gutting had cost. The World Health Coalition was reformed with a permanent emergency rapid response authority that had not previously existed. International cooperation, strained before the event by decades of political fragmentation, was forced by sheer survival necessity into frameworks of coordination that outlasted the crisis. Nurses and community health workers received formal recognition and compensation structures that they had long been denied. In Marco's village in northern Italy, they put up a small plaque, we learned this months later, that said simply, "Here we chose to be decent." It became something of an international symbol. Photographs of it circulated globally. People put it on their walls. They were not celebrating survival. They were pledging something to themselves about what survival was for.
The 22 nations that remained unaffected, Iceland, New Zealand, Bhutan, and 19 island nations, did not emerge unchanged. Their isolation cost them economic devastation. New Zealand's economy contracted severely before the antiviral reached it through humanitarian supply chains. But their populations survived intact, and in the years that followed, they became among the loudest advocates for a permanent global health security framework that would prevent any future pathogen from having the kind of simultaneous multi-point emergence that NX9 achieved. That investigation into how a virus arrived in 19 cities on 6 continents within a 6-hour window was never fully resolved publicly. Multiple theories were advanced. No definitive origin was confirmed. The question remained open, a wound in the world's understanding of itself that no political will was sufficient to close. What was confirmed was the response. What was confirmed was the choice that billions of people made, in thousands of small and large ways, to act as though the life of the person beside them mattered as much as their own. That confirmation turned out to be the most important data point of all.
We are at the end of our first 24 hours of continuous coverage. To every viewer who has been with us through this broadcast, thank you. To every person who sent a message, Priya in Mumbai, Owen in Chicago, Camille in Lyon, Thomas in Manitoba, Jiwan in Seoul, Anya in Krakow, Farouk in Cairo, Marco in Italy, and the unnamed doctor at King's who asked to be seen. We saw you. We see you still. To the firefighter named Raj, to the women going door to door in Nairobi, to the soldiers cooking meals for nurses in Paraguay, to the scientist in Bangalore who found a vulnerability in a protein structure at 2 a.m. You are the reason the ending was not worse. You are the reason there was an ending at all. The world stabilized. It adapted. It carried its grief forward into a future that by every right, it was not supposed to reach. And it reached it anyway. Because that is what human beings do. That is what they have always done, and that is what they will always do.
I am Alex Mercer. This has been 24 hours of Silent Waves emergency coverage. The crisis is not over. The work is not done. The grief has not been fully felt and will not be for years. But the night has passed. The tools exist. The will, improbable and stubborn and absolutely characteristic of our species, persists. Stay home if you can. Help your neighbor if you are able. Trust the people who trained for this, and hold on. We will be back at the top of the hour with continuing coverage. Thank you for being here with us.
Thank you. Good night, and good morning wherever in the world you are watching. A new day has come. It is hard, and it is uncertain, and it belongs to us. Take care of each other.